Each woman who comes to me has a very unique condition from their prior breast implant surgery. One or many individual issues can be present with each implant. It can be a position problem with the implant. It can be a scar tissue problem with the implant. It can be a rupture problem with the implant. It can be a feel problem with the implant. That is, it feels too hard, or there's a sharp wrinkle that is obvious and disconcerting. The most common is asymmetry, where the two breasts don't look alike, because during the healing process, one implant healed a certain way and the other implant healed a certain way, leading to an asymmetry that oftentimes worsened as time passed. The kinds of things that I need to know that are important in my assessment are what kind of implant it is, what size of implant it is, what the location of that implant is. Is it above the muscle or below the muscle? How many years that implant has been in place? So these are the kinds of information that I seek when I'm evaluating a person who has had breast implants. Sometimes the implant might be out of place, and that's the sole problem. But sometimes the implant might be out of place, but the breast tissue has a certain characteristic that even if the implant were in the right place, it still would not be an aesthetically appealing breast. I have to be able to discriminate between the implant and its condition and the breast tissue and its condition, and come up with a plan that incorporates the entire breast, and then match that with the other breast, which might have completely different conditions. So we're really looking at breast implant, breast tissue, skin quality on one side, breast implant, breast tissue, and skin quality on the other side, and then trying to make the two breasts match with whatever we decide is necessary to accomplish the aesthetic goals that we set out. With breast implant surgery of any kind, it's important for me to know, what does she see as ideal? Does she want soft? Does she want firm? Does she want good fullness in the upper part of the breast? Or does she want a more natural slope of the breast? Is it important to have a lifted, perkier breast, or does she like the more natural slope of a breast? Does she want a more youthful, artificial look? Or does she want implants that are less obvious? So all of these parameters need to be discussed and a plan developed to get close to approach the goals that are set out. And that may involve new implants, it may involve silicone implants, it might involve saline implants, it might involve smooth implants, it might involve textured implants, it might involve a breast lift procedure, it might involve reconstruction of the pocket inside the breast around the implant. It is also very important to take into consideration the native anatomy, that is the breast that exists, that is there, if an implant weren't there, and the anatomy, the chest wall, the structure of the rib cage. Those things are important to analyze as well, so that when the procedure is performed, a good understanding of how those structures can affect the final result is known ahead of time. The limitations of the procedure must also be discussed, because not every breast surgery can result in perfect breasts achieving the exact goal that someone might want to achieve. The best we can do is to approach that goal, is to do everything we can to get as close to that goal as possible.